Welcome to ITV Gold. Thank you so much for giving us your time today.
Thank you, Aditi. Always a pleasure to be here with you.
And it's always a pleasure to have you because we have a lot of questions. So, my first question to you has to be about the biggest news coming in today, Doctor. The FDA has given emergency use authorization for the booster dose for 16 and 7-year-olds.
Mhm.
Huge news. People are calling it a game changer. I'd like
Yes,
to know, how are you observing this news and how important do you think this step was for the FDA to take?
I think with the holiday season coming, we are all going to get together. This is the time for family gatherings, and having this authorization, this recommendation will be a huge safety net for all of us to get together. This has been a rough year and a half for us, and everyone wants to get together with their families, with their grandparents. Multiple generations will be coming together. So, having these young adults getting boosted would be the great thing. And Aditi, at this point, getting a booster is the new definition of being fully vaccinated. So, I would like all our viewers to know this, that if at this point, if you can get a booster because that's when you're fully vaccinated, because the immunity from previous vaccination has started waning off.
Right. Let's talk about what is happening in the country because it is kind of concerning. And we are in the Northeast, doctors, so we keep on hearing that we all have to be extra careful now with the winter season coming. We're at
Correct.
49 million cases, actually more than that in the country right now. 792,000 deaths total in the nation. Currently, we are seeing 120,000 cases per day, all related to Delta mainly. Please explain to us, why is this happening right now? How concerned are you? And what do we need to do with this holiday season coming, especially?
Great questions, because this should be a concern for all of us. As you said, the whole country, the entire nation is seeing a huge surge in the infections. New Jersey has reported a significant increase in all the cases, and most of the cases are because of the Delta variant. We should also see not just New Jersey, but let's focus on the entire Northeast because there are some very worrisome trends emerging. Let's look at New Hampshire and Vermont, and I'll tell you why I'm saying that. New Hampshire and Vermont have approximately 70% of their population vaccinated, just very similar to New Jersey. And from an infectious disease perspective, when we are tracking their trends, New Jersey usually tends to be about 2 weeks behind these states. And at this point, we are seeing a huge surge in COVID-19 cases, mostly because of the Delta variant in Vermont and New Hampshire. These states were at pretty low numbers in the
Yeah.
first surge. Now they're seeing a huge surge, and their rates of hospitalizations are more than ever. So, just to follow the trend that we have historically followed for a year and a half, I do think that we are going to see a big surge in the hospitalizations. And unfortunately, our death rates will climb. Uh, Good news is, from our perspective, we now know how to take care of COVID-19 cases much better than we had before.
So, is the concern, doctor, the unvaccinated population at this point, or are you equally concerned about fully vaccinated individuals?
A little bit of both.
Okay.
And I'll tell you the perspective that I'm seeing from on the grounds in the hospital. We have started seeing a significant surge in COVID 19 infections, and not just infections, but the severity of the infections. For some time, especially in the summer months, we had not had any COVID patients in the ICU. And now we are seeing severe cases with COVID pneumonia, again, ventilator and pressors. And we are seeing a trend emerging. We are seeing patients in their 50s who are unvaccinated coming deathly sick with COVID 19. And then we are seeing patients in their 80s coming with COVID-19 infections, and these patients are vaccinated. So I'm thinking there that immunity is also waning. And at this point, a booster is extremely important. People who are 80 plus year old have multiple medical conditions, so that might weaken their immunity. However, I'm definitely seeing a surge in both vaccinated younger population and unvaccinated younger population and vaccinated older population presenting with COVID-19, severe COVID-19 pneumonias now.
So, from a cardiology perspective, how are you looking at people that have heart issues? And there's a lot of members of our community, doctor, that actually fall under that category. How many patients are you seeing with that? And the patients that you have, how concerned are you about them?
Very concerned. You raise a very good point that people with heart disease are at high risk for COVID-19. And the reason is that heart disease comes because of multiple risk factors, which are very prevalent in our community, such as diabetes, high blood pressure, truncal obesity, hyperlipidemia. All of these are extremely prevalent in South Asian communities. And as a result of that, heart disease is also very prevalent in South Asian communities. When we have that, that becomes kind of a perfect storm for COVID-19 infections. So getting yourself vaccinated and especially getting yourself boosted is very important.
Right.
And,
Go ahead.
and you raised a very good point about holiday gatherings. So if I can take a moment to talk about what to do. With holiday gatherings coming, we all are going to get together with our families. And I would like to take a 3-step approach. Get the booster before you decide to attend a holiday gathering, because give yourself that extra margin of safety. We are noticing that the immunities are going down. So getting boosted is the only way you can consider yourself fully vaccinated before attending the meeting. On the morning of the meeting, you should take and pass the rapid antigen test. You don't have to go to a facility. There are now rapid antigen tests which are available at Walgreens or CVS. Get them and pass them, because you're going to meet your loved ones and you want to protect not just yourself, but them as well. And third thing is, if you're not feeling up to it and if you're feeling sick, don't shy away from saying, I'm not feeling well, I can't attend. If you take these 3 steps, then you should be able to attend and enjoy the family gatherings.
And those steps are, again, very important. And vaccines.gov is the website that everyone can go and find more information on the COVID-19 vaccine. We were talking about heart and the cardiology perspective here. I have to ask you on that, another big question that's concerning parents nationwide. We're seeing lack of vaccinations amongst children because of that. This fear of this heart inflammation disease that is being seen as a reaction to the COVID-19 vaccine amongst the younger generation. I need to know from you, how are you looking at this, and how dangerous could this heart inflammation be?
There have been reports of myocarditis after the second dose of the vaccine. It's also more prevalent after the second dose in young males. So I understand the reason for concern, but let's not forget that if kids or young adults don't get vaccinated, and if they do get COVID also have long-term ramifications of cardiac issues. It could be myocarditis, it could be inflammation of the heart muscle or the sac that holds the heart. We also know that other than cardiac, there will be other side effects or long-term effects of COVID, including neuropathy, fatigue, heart blocks, all of that. So when you take all of that into consideration, the benefits of COVID-19 vaccine outweighs the risk of myocarditis, as the prevalence of that is very, very small.
And is it easily treatable, doctor?
It is. And the most of the time, the
Right.
treatment is symptomatic. And the good news is that most people recover from myocarditis without any residual effects. We cannot say the same thing about COVID 19 long term effects. So I still think it's an American Association of Pediatrics also recommends COVID 19 vaccine because the benefits outweigh the risks.
Yes. So do you think they would be eventually pushing boosters for even young children ages 5 to 11 because they are getting a smaller dose of the vaccine to begin with, doctor? So how would that be evaluated?
If I have to project and speculate, when I'm seeing the trends, I would say that the boosters for younger kids also should be coming soon. And we have seen that in a lot of other infectious disease cases. Uh, Most vaccines that the kids take do have boosters. So I would think this vaccine also will follow the same trajectory.
In terms of India, doctor, now my question is Omicron has also been detected in India. There is a lot of travel going on between the United States to India right now. Travel is actually at its utmost that we have
Mhm.
seen in the last 2 years. What do you have to say to those travelers that are going to India right now? And would India be in trouble with this Omicron if it spreads, doctor?
Unfortunately, my feeling is we may see Omicron to be more of a problem in India, and the results are fewfold. One is everyone has COVID fatigue. Uh, People want to get out, people are tired of the vaccines, the masks, the virus, everything. And second thing is that this virus is very prevalent, and 75% of the cases that are in South Africa now are Omicron. And India has a lot of trade relationships with the African countries. And that's why I think there will be a lot more contamination, cross contamination of Omicron in India. And it is a reason for concern for me. Indian government had put down some quarantine measures. And I think they need to be taken seriously. And I know that they're being scaled back. I would urge people not to travel unless there is an absolute necessity, because I do feel that Omicron might play a prominent role in India.
So here's a follow-up question for you. Do you think the Indian healthcare system, which is basically on the brink of collapsing, doctor, it's been on the brink of that. There's nothing to hide about it, unfortunately. Is it ready if there is an Omicron surge?
I would love to say yes, but I have my doubts. India does not even have boosters yet. So
Yeah.
think about this, the immunity is waning, people have COVID fatigue, and then now we have a variant which is a lot more infectious.
Yeah.
And Indian subcontinent is plagued with diabetes, hypertension, obesity, all the risk factors. So I would urge everyone from our community to be super, super careful and cautious.
Yeah, I mean, this is the guideline you were giving us a year ago, doctor, about traveling, and it seems like we're, going through this again. It's a cycle number two. Just a couple more questions left for you, doctor. The U.S. government made a huge announcement saying that they will invest about $400 million in a global initiative for vaccine distribution. It's targeting poor, low-income, and mid-income countries, and a lot of these countries actually have had no access to vaccination. So my question to you is, while we are focused on the booster, do you think the focus should be on sending first doses out to more and more nations? That's what the World Health Organization is saying right now. How are you looking at that, and how should this be handled?
In my opinion, you need to protect your own population as well as the first dose. We know for sure that the immunity from the vaccination, initial vaccinations, is waning now. We are coming in the flu season. The temperatures are getting cold, so more people are going to be indoors in the United States.
Right.
And in addition, Delta variant is surging in the US, and now we have the Omicron variant. So I do believe that the push for vaccination that the government is doing is the right thing to do.
Yeah.
In addition, if we have, we should send it to people who do not have access to vaccination. But I think push for booster is the appropriate thing to do.
You know, the government on a federal level and even on a state level in New York, New Jersey, are pushing for vaccine mandates at this point because they see no other option left. As a medical professional, your personal opinion, not even political, should there be vaccine mandates for all of us?
This is purely my personal opinion, but I do believe yes, because the vaccination is important to protect yourself and people around you. So to me, it's social and civic responsibility to get vaccinated, to protect your workplace. The economy has been strained. The workforce has been strained because of this virus. And although US economy has done well, the supply chain is broken, and we are seeing this virus uh, creating overall fatigue everywhere. So the only way to overcome this is to get yourself vaccinated. And if you're vaccinated, get boosted.
Yeah, that is so important. Again, vaccines.gov is the website. My final question to you has to be, I'd like to know a prediction from you for this month and the next month as we go into the new year, and maybe some more precautionary measures if you could share some.
Unfortunately, I think next 2 months are going to be challenging for us because of the flu,
Right.
Delta, and increasing cases of Omicron, which are very virulent, yet may not be as dangerous. This gets compounded by the holiday seasons where everyone is going to gather together. So mask up if you are going to be amongst people that you don't know. Take the rapid tests. The tests are being underutilized. So take the test, protect yourself. And if you're not feeling well, no shame in saying, I don't feel good, I can't make it. And this is for everyone's protection.
Yeah, that is so, so important. Well, I look forward to having you again in a couple of weeks on the channel. Hopefully, we have some good news to share, Doctor.
Thank you, Aditi. Thank you very much. And I wish every viewer of yours a very merry and safe holiday season.